most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
What is causing your shoulder pain? Arthritis? How to tell? So we're going to go through the symptoms that we believe and signs, objective signs that may indicate that you have arthritis.
Right.
So pretty common with shoulder arthritis. Man, if we bring Sam
Bring him over,
Brad.
Sam. Let's see what's going on.
So you have cartilage that covers the humerus, the ball here, and you also have some here, and you have basically a little thin piece of cartilage going around in there, the labrum.
The labrum, yes.
So this can, over time, it's like Teflon, and you know how Teflon starts to wear off your pan? You know what I mean?
Yeah, you should throw your pan away by then.
I know, by that time, yeah. It starts to flake, and it starts to wear down, and eventually you get what is called bone on bone.
Yeah.
And that's what you see quite often. Obviously, that can hurt.
And sometimes, we're talking about it before, you can hear and feel people that have arthritic joints. It can be pretty significant.
Really loud.
Yeah.
On some people, the grinding noise, clicking, cracking. You can also get arthritis, by the way, just as a thought here, in the acromioclavicular joint. That's the clavicle or the collarbone, where it attaches over here. And this can give you some pain right in that area too. So just to let you know, I guess that's as an aside.
Yeah, I dislocated that, and the doctor said after this last visit, he says, "Yeah, you're going to have arthritis in that joint."
Have you
prematurely?
Felt it yet?
No.
Yes. He is almost.
It will next year, probably.
Probably,
now that I mentioned it,
it'll start up. Yeah. You can move that out of the way, Brad.
All right.
So with arthritis, generally you can feel pain in the front, the side, and maybe even the back a little bit.
Mm-hmm.
It can refer down the arm a little bit, but it's certainly not going to go into your forearm or hand or fingers.
Right.
That would be more of a neck problem or nerve problem. So
sure.
you might I'd say you'd see referral down into this area possibly with arthritis.
Yeah. You may feel more pain when you're pushing or bearing some weight through the arm.
Because you're grinding it then. Think about it. You're grinding that joint together.
Yep, just kind of.
So, one of the habits that I'm into, which you should try to avoid, is I lean on one arm when I'm reading the paper or eating my cereal or eating. And, you're really leaning on that arm, and it's internally rotated, so that's even worse.
Yep.
So you want to get out of those habits of leaning onto the arm. Some people often lay in bed too, in that propped up position.
On their stomach?
Yeah. Can I show?
Well, that's like when you watch TV when I was a kid.
That's what I mean. Some people, I read like this sometimes in bed.
Really?
Yep.
Oh, I guess my neck's sore.
It's good on my back. So
I see. Yeah. I can't do that one.
Yeah. So, the other thing, if you're lifting a heavy object and the joint is really, grinding together to hold the joint in place.
Yeah.
You could have pain with that. Arthritis, it can start to even hurt at rest if you've been doing a lot during the day.
Yeah.
So, but one of the telltale signs, I think, is that your shoulder becomes limited in motions.
Right.
And the motion that tends to be limited first and the worst is external rotation. And we're going to show you how to measure that, but that's basically turning the arms out like this. So that, not out like this, elbow in, out like this. That's the one that tends to be most limited. Like some people you'll see that can't even go out like this at all.
And this is something you have to actually think about because normally people don't do this in real life.
It's all part of a complex series of motions, probably.
So we'll show you the way to assess it more.
The second one that tends to get limited, not as much as external rotation, but the second in line is abduction. So that's just going up in this direction. And you'll see a lot of people that can't go any higher than this. And it's not just a matter that they're getting pain up here. Like they're limited. They hit the wall.
Sure.
It just won't go any further. And the last one is shoulder internal rotation, which is basically like this.
Yeah.
And we'll show you how to measure all three of these laying down on a flat surface.
Right.
So
it's the best way to assess it. Actually.
So I'll do that, and you can be like the interpreter.
Sure.
Like the how they have interpreters that.
Ideally, if we had a
sign language interpreter.
Yeah, if we had a camera up here looking down, then you could see it, but I'll be the camera explain what it looks like.
So I have elbows into my side, palms facing each other, and then I'm just going to let them go out like that. And you're going to see, is one tighter than the other? Is your painful shoulder tighter than the other? And that might mean that you have some arthritis in the shoulder because it's the joint has tightened up on you, the capsule.
You may have to have someone else look at you because it's kind of hard to see. But you know, the distance from
if it's really, you know, a lot, I think you're gonna be able to pick it out. How's it look now?
You're a little higher on this one, so the distance from this hand down, if the bed came out, is a little higher than this one, but it's pretty close.
Now this one, you just put your thumbs up, or you can actually put your palms face up, and just you're gonna go out to the side like this. I'm gonna run to the wall here.
So he's doing kind of like that snow angel. If you were
now, you can see on this one, I have more trouble with this one. Don't you see that, Brad?
Oh yeah, your right shoulder is tighter than your left.
No, my left shoulder.
Oh, that's right. My right, your left.
So definitely trouble that, and I've had issues with that one. I've had a muscle that got paralyzed. So last one is you're going to actually put your arms out to a T, so straight across, palms forward, and you're just going to let it rotate forward like that.
Yep.
How do I look on this one?
Yeah, pretty even. And from the camera angle, it's a very perfect angle. You can see, you know, do it so it wouldn't be even, just to make, you know, like, so that one's down and this one's up high. That would be, this would be the tight shoulder. So, yep.
So that'll give you the idea. With arthritis, we'll be showing you some things you can do for it, but basically you're trying to regain that motion as much as possible. That's the best thing for it. Thanks for watching.
Oh, that's it.
Yep.